Good afternoon, Endometriosis Summit crowd, and welcome to a Facebook Live. Why don't you go ahead and introduce yourself? I am so excited to have you here, Dr. Jen.
And I am so excited to be here. Thank you so much for having me. As I said before, it's so nice to finally meet you. I've heard so many great things about you and just what a wonderful advocate you are. So I'm just thrilled to be here. So I am Dr. Jennifer Ritchie Goodline. I'm a licensed psychologist. I'm based in the Denver, Colorado area. Yeah, that's me. I do specialize in a lot of women's issues, including women's reproductive health issues. And so that is something that's part of my practice that I do a lot, in addition to anxiety and depression, stress, relationship issues, things like that.
We are here today because so many people are not only socially distancing, but socially isolating, but so many have stress and anxiety as we open up, that it was time for the Endometriosis Summit to say something to our crew. And I wanted to just start with how are you doing?
You know, I am doing okay. It's been an interesting switch. Honestly, I've been seeing all my clients through telehealth. And so that's been an interesting switch to do, I think, for a lot of people. And I'm fortunate that I have that platform that I'm still able to see people safely through telehealth. But honestly, it's been some challenges. You know, my clients have heard dogs barking and sometimes my kids yelling. And so I think, you know, I keep trying to remind people we're all just doing the best we can, myself included, right? We're all human and we're all kind of doing the best we can and trying to adjust to this new normal, which I don't always love that saying, or this new abnormal, as best as we can. But I'm hanging in there. How about you? How are you doing?
I'm doing good. I'm having a birthday on Monday, so I have all sorts of feelings. Of course, you know, we're an endometriosis crowd, so anyone who's experienced fertility issues and has birthdays, and especially is maybe female, goes through changes, and, you know, lots of feelings around that. But also, I loved what you said, like, we're all just sort of figuring it out together. I'm seeing telehealth. And on, like, I not only have dogs barking in the background, I had a dog pass out in the middle of the session that, you know,
oh my goodness,
I go running to a vet, pass her through a window and ask. But I also have parents. And I think, you know, it's somebody once said, I was on a session, they said to me, "Is that a baby crying?" And I said, "No, my mother." Like, there's nothing, you know, sometimes there's nothing you can do. And yeah. So, I mean, what are some tips? So first of all, so happy to have somebody who has a pelvic health background on, because I think you get the baseline challenges of what it's like to be, for clients to be in pain all the time. How would you let somebody who can't necessarily count on their body, what are some tips for navigating this new abnormal? I love what you said there, this abnormal.
Well, you know, it's interesting because I think, as I said, one thing that I've really been stressing to people as I talk to them is really just trying to do the best you can, whatever that looks like for you. And we talk a lot about self-care, you know, which psychologists have been talking, therapists have been talking about self-care for a year. I think it's kind of become more popular, that it's kind of become more mainstream, which is wonderful. I'm glad to hear people talking about that self-care piece. I think though, as it's become kind of more stream, sometimes pieces get a little lost in translation, right? And it gets a little bit misunderstood, in the sense that I think now when people talk about self-care, sometimes it's like, well, let's take a long bath and eat some cheesecake, which, you know, if that's your self-care, that's awesome. Like, I'm not knocking that. Do what you need to do for you. But, you know, self-care, I think, also means figuring out for yourself what that means to take care of yourself. And so that can be things like making sure your medication is filled, giving yourself permission to take pain medication if you're in pain and you need to, or to take it so that you can get ahead of that pain so you don't need to struggle, right? It can, and you know, can mean long bubble baths and eating cheesecake too. It can mean, though, learning to say no, setting healthy boundaries for yourself. It can be knowing that difference between when you push yourself a little bit, right, to do the things that you need to do, that to exercise, to do the things that you need to do. It can also mean, though, recognizing when your body needs to rest and that it's actually not helpful for you to push yourself. And so I think it really means a lot of different things to different people. I think kind of in general in this pandemic, a lot of the things that I've been talking to people about are kind of some basic self-care sort of things. And, you know, managing anxiety. I kind of keep framing it for people. We're all sort of in this collective trauma. We're in this collective anxiety, really. And so I think some of it is balancing what that looks like for you. So, you know, obviously we all want to stay informed. We want to be aware of what's going on in the world and what's going on in terms of this in COVID and the pandemic. But we also want to make sure that we're limiting that balance, right? We're balancing that how we're watching news, how we're absorbing social media, because I think it can be so overwhelming at times. So you want to be informed and aware, absolutely, but you also want to limit what that looks like sometimes, because I think it can be very stressful, you know, and I also think it can be very stressful to see things on social media and those posts. I keep kind of phrasing it as resisting pandemic productivity pressure. You know, we see these things where people are like, I'm learning a new language and I'm painting my house and, you know, I'm training for a marathon. And again, if that's how you manage this, right? If that's how you manage this, then I'm all like, yay, do that. That's great. But I also think people need to really recognize that they don't need to do that. Sometimes it is just getting through the day, right? Sometimes it's just managing your pain, managing yourself, managing your household, and really what that looks like for you. And I, you know, like I keep saying, my tagline through this whole thing has been just do the best you can, whatever that looks like for you. And I think it is important to kind of limit some of that stuff. I also think, you know, it's important to, I keep telling people, try to get outside a little bit. You know, if you can, there's a ton of research that talks about moving more, I'm sure you're well aware of this, right? How moving more affects our mental health, how the links to being more physically active have lower incidence of depression, anxiety, or at least helps with some of those symptoms. And getting outside also do the same thing. If you can do both of those things together, I think that's great. I know sometimes, though, that is a struggle and a challenge for people who struggle with chronic pain conditions. And so again, I'm not suggesting that someone push themselves or beat themselves up if they can't do that. But sometimes even if you can just sit outside in your yard and get some sunshine, if you can safely walk around your block, right? That's the other thing. I know some people live in areas where they feel like they can go take walks and it's great. Other people live in areas where it's so highly populated that they feel like going out increases their anxiety and stress. You know, so some of those things of, you know, if you can get outside and take a walk around your block safely, if you can get outside, whatever that looks like. If you can try to nourish your body, and I say this with a little bit of hesitancy because, yes, I want you to be eating healthy food, but it's also okay to like stress break bounties and stuff like that, right? I mean, those things are okay too. So it really is about that taking care of yourself.
Yeah, I thought, you know, there's all this like FOMO, but like fear of fear of missing productivity. And so I was I take a business class, which I always take. But I was in on Thursday and we're in Zoom, and somebody was like almost crippled by their fear they're not producing an online course, and they don't have a business coach, and they're not they don't have 15 telehealth patients, and they're just really trying to homeschool their kids, and they're trying to just make sure they have their PPP filed properly. And like I think it's really become a big thing during this time in my professional life, that we have to push and push and push. People want to know, what's the Endometriosis Summit doing in March? Like, it's in March and I can barely get to next Friday. So and I think it's okay. Casey Berna, who is a social worker that works with the Endometriosis Summit, she said something in one of our first lives, that you should control the controllables. What do you think about that?
Yes, absolutely. And that's another big thing that I've been talking to people. I think when we're in this place, a lot of our anxiety is getting flared, I think, and it really feels there's such an uncertainty about this time. You know, if someone sort of said to us, hey, if you can just stick it out till May 31st, all this will go away and it will be all okay, we'd all be like, all right, this sucks, but we can do it, right? But I think that uncertainty piece, what's safe, what's not, when we're hearing a lot of conflicting information, absolutely becomes very overwhelmed, and it triggers that anxiety response for a lot of people. And so what I often talk with people about in terms of anxiety is, right, control the pieces you can control. You can't control how your neighbor is social distancing. You can't control if, someone's wearing a mask, but you can control the pieces you can control, right? You can do what you need to do for yourself. You can say, this
Now,
is
this my psychology session? Because like on a daily basis, like I'm in an apartment complex. I'm not used to apartment living. I came somewhere because my parents were somewhere we had to all be together. So I came very early March, like before the country shut down. But I opened my door and I peer at, Ma, they're not wearing a mask. And then I got a Starbucks this morning, and first I wouldn't touch the door handle. I had to, and I'm with the towel, I'm wiping the handle, I'm putting them in, and everybody sees me do this. And then the person that went in front of me, she opened the door, no mask, and walked in. And the Starbucks lady looked at me, got a little scared because she knew I was a freak, and then like yelled at the other lady. And I was like, see, and it justified that I've been trying to control all these people.
Right.
And yesterday I told the person they weren't wiping the furniture down at the pool the right way. I am definitely like, I think it's important. That's a good thing to say. Like, I think a lot of people out there are like me with endometriosis because we haven't been able to control anything in our lives ever. And so we've become a little compulsive because if it's not just right, we have to keep going to school. We have to keep going to work. And so maybe that means obsessing about what we eat for 3.5 hours before we actually eat it. And now it's transferred into COVID. Yeah.
Absolutely. And I'll use myself as an example. I never in a million years thought I would spend 40 minutes wiping down groceries. And quite honestly, if one of my clients had told me this 8 months ago, I would be talking to them about, let's talk about that anxiety and germ phobia and how do we not do that? Now I'm like, you know what? If that helps you feel safe, then do that, right? Control the pieces you can control. And kind of that piece of no more, no less. Wash your hands when you come in, be careful about things, but we also need to make sure that it doesn't trigger that anxiety response where we're like washing our hands 20 times. Did I wash them well enough? Did I wipe down that bag of chips well enough? Maybe no one else is buying chips. Maybe that's just me, but did I wipe that down well enough? I think some of that is managing that anxiety response too, of reminding yourself, I'm doing the best I can. I wiped it down. It's okay. And it's such a tricky balance during this time. Again, especially when we're hearing all this conflicting information. It's safe to do this. No, it's not safe to do it. We should all be wearing masks, which we all should be wearing masks, but that's a whole other thing. I don't want to get into a controversy, but I also get that that's hard for some people. If their own anxiety or trauma response is triggered by wearing a mask, that can be difficult. So I think those are the pieces. And I can't tell you, I haven't had the same experience with people of why aren't they wearing a mask? And how come they're having people over at their house? What is wrong with them? But you do have to kind of take a step back and say, everyone has a different risk tolerance and everyone is handling this the best they can. And so the only thing I can do is control what's okay for me. Yeah.
I think the other thing, and I don't want to be so controversial, but like you're in Colorado, I'm in Florida, but I'm closely tied to New York and New Jersey because that depends. Am I going to be able to go? Am I going to have to stay? And I think the fact that it's different everywhere, and I don't mean to make this a political thing, but it's different everywhere because infection rates are different everywhere. What is going on in New York is not what's going on in Colorado. What's going on in Florida is not what's going on in Idaho. So people, it's scary for them, and there's no end point, but there's often no answers. How do you support somebody in that kind of condition? Do you know what I mean? Like, how do you we don't have an end point, we don't have any answers. How can, I don't mean console, but support us all as we move through it?
And I think that's a great question. I don't know that I have a great answer for you, right? As I said before, I think this is the hard part with this uncertainty. And I cannot tell you multiple times a day, I wish like I could have this great, wonderful thing that I could say to people that would make it all okay. And I can't because I don't know. What does this endpoint look like, right? What does this look like? Are we going to see a rise in infections? Is it going to go away? Will we get a vaccine? Will we not? Will it be safe? I mean, people are really starting to question what this looks like. And I think as this has kind of went on, you know, I think initially it really spiked people's anxiety up, which I think is still the case. I think as it continues to go on, people are starting to feel some depressive symptoms too, right? The fatigue of it all, of wiping down groceries, of not being able to leave their homes in the way that they want, and having activities that they normally would do, not being able to do that, having special events and occasions, trips canceled, things like that, right? And I think it really is affecting people's emotional health and well-being, their mood, all those kind of things. And, you know, I often say that to people. I don't have a great, wonderful answer. Again, what are the pieces you can control of this? You know, what are the things that you can do that can help you sort of ride through this uncertainty? What are the pieces that feel okay for you? What's your risk tolerance? How can you, despite, you know, birthday celebrations being canceled and graduations not happening and trips being canceled, what are things that you can look forward to? Where can you find the joy in things? You know, what feels safe for you? There are plenty of people now in Colorado where on kind of this partial reopening, safer at home is what they're calling it. And so some hair salons have opened up, you know, and people are saying to me, is it safe to go there? The reality is I can't answer that, right? I'm not an epidemiologist. I think people have to weigh out those risks for themselves of, does it feel okay for me to go to? Does that feel like an acceptable risk? There are some people who would say absolutely not. And there are some people who would say, you know what, it's worth it to me to do that. And I think that's what people have to do, trying to ride out that uncertainty. But I think that's the hard part is, I wish I had a great thing I could say to you, like, this is how you do it. I think it's really figuring out for yourself what you need to do to take care of yourself and how you get through that and how you manage that for yourself and for your family.
Yeah, I think and everybody's situation is unique, because there are some people with endometriosis who are really not any higher risk. And there are some people with endometriosis who maybe have long endometriosis, or
Right.
who have other comorbidities that can make them high risk, but also can make them people that have to go to doctors.
Right.
And they have to leave. And that's very anxiety ridden. I think also we all feel very displaced from our lives.
Yes.
Right? So I know that there are special occasions with you, like I'm having a birthday, people are like, what are you doing? I'm like, what do you want me to, what do you want? I'm having Dr. Jennifer Richie Goodline on, and then Sunday morning we're gonna dance on Instagram Live. So yeah, but there isn't a lot of stuff, you know, and I think people are like, oh, well, you should have balloons and you should have, we have what we have.
Right. And I think that's a thing. People have to manage it the best that they can. For some people, that does mean balloons, and they want to figure out how they do this. You know, I guess for me too, a piece of that, I'm kind of going a little bit on a tangent, but I think a piece of that is allowing yourself to feel your feelings about that too. You know, it's hard. And I think well-meaning people all the time say things that are really kind of invalidating and dismissive in terms of feelings. Well, I'm sorry you can't celebrate your birthday on Monday, but at least you're not in the hospital on a ventilator. And it's like, well, yes, that's true. I'm very glad, right? I'm not in the hospital on a ventilator. Absolutely. And yes, people are dying, and I recognize the importance of that and the significance of that and how scary that is and how real that is and the suffering that people are going through. 100%. I am not discounting that at all. However, it is also okay, though, for you to feel sad or angry or upset or frustrated that your birthday is canceled, that your kid's not having a graduation, that your doctor's appointment was canceled, that maybe your surgery was postponed, that the summer trip that you planned last year that you've been looking forward to all year long is now not going to happen. Those are valid things to feel angry and upset and sad and frustrated with. And that can coexist, right? You can recognize the severity of the situation and absolutely have empathy for people who are sick and dying and struggling, and still feel sad for yourself. That doesn't make your feelings any less valid. It doesn't make it feel how it's affecting you any less valid or any less real. And I think that's sometimes a hard thing. You know, people tend to discount, well, it's okay, you know, my surgery was postponed, but right, at least I'm safe. And while I think it's absolutely important to recognize that and have gratitude for the things you do have, it's also equally as important, and again, those two things can coexist, to say, I'm really upset. I wanted this surgery, or I wanted this to happen, or, you know, and what that looks like for you. It kind of makes me think in some ways of endometriosis, right, in terms of how it's treated often. That, you know, people talk about, well, endometriosis isn't a life-threatening disease, right? It's not cancer. And they very dismissive, very invalidating. And yes, that is true. Endometriosis isn't a life-threatening disease. I would argue it's a quality of life-threatening disease for sure, but it's not a life-threatening disease in the same way as cancer. But does that make it any less important? Does that make the impact that it has on people's lives any less valid, any less real? Absolutely not. And I think that's really important for people to hold that frame too of, yes, it's wonderful and you can recognize the severity of things, but you can also be sad that your vacation was canceled, that your birthday celebration isn't going to be what you wanted it to be.
Yeah, I think it's also for so many with endometriosis, life just looks a little different than you imagined before you knew,
Right.
you know, when you were younger. So maybe you didn't have children, maybe you didn't have as many children as you wanted, maybe you weren't able to maintain your relationships, maybe you don't live in the house you wanted to live in because you financially spent everything on care. And I think being home, we are so social media centered right
Yes.
now that so many are worried, like, oh, I'm not out on the lawn with my children dressed up taking pictures before we have a 1,200 family Zoom dinner, you know, like,
Right.
by the way, so a patient actually wrote that to me and I was like, it's okay.
Well, and it's interesting because I'm actually thinking as you were talking of a conversation I just had with someone recently where they were, you know, they don't have children. They've struggled with fertility issues. And she said, if I see one more post of someone complaining about homeschooling their kids, I'm going to lose my mind. Now, again, I don't mean to discount how difficult it is for people who are trying to homeschool their kids and that distance learning piece. That is hard, not invalidating at all. But it also brings up, you're absolutely right, for people who maybe their life didn't turn out the way they want or they don't have that in their life, it can bring up a lot of things. And I'll go back to my, you know, what I said earlier, not to sound like a broken record, but I think that is important. You're absolutely right to limit that viewing, because the truth is on people's social media, right, we see their highlight reels. Well, or sometimes we see some other stuff, but that's a conversation maybe for another time. But for the most part, right, we see them sitting out on a lawn, all of them dressed up. Even in a pandemic, we're having a picnic, you know. And again, I don't knock that. If that's the way that people cope with their own stress and anxiety, knock yourself out. That is wonderful. But I think absolutely it can make other people, you know, it has that impact on other people where you feel like, right, I'm not doing this right. I'm not doing this pandemic right. And the truth is, yeah, this is an unprecedented time. None of us are doing it right. We're all just doing it the best we can.
Right. And I think I saw the best Instagram post in a story yesterday. She happens to be a school psychologist, but the best was, this is what you see. And it was like a pretty picnic table. And she was like, but if I just hold the camera a little bit to the left, and you saw she had like boxes and garbage and leaves that hadn't been taken. And she was like, you should remember this is what people's lives are really like. And now, like, I think, you know, with endometriosis, even with excision, and I believe in excising the disease at its root, but a lot of people want to say, I had excision and I'm horseback riding, and then I go skydiving when I'm not, you know, when I'm bored, and I'm drinking, you know, orange juice that I bother my bladder before. And like, the reality, no, like, that's that person. And that's what they're showing you, because they're not showing you after they suck down the pineapple matcha from Starbucks that they laid on the couch screaming in pain because they're not showing you that part, right? Because it was so acidic for their bladder. They don't show that part. And I think like we should remember that. And I also kind of say, and you're, you know, a professional, but if they have to show so much of that, maybe the problem is not what you're missing.
Right. Absolutely. And I think that's a big thing, you know, right? Comparing yourself to others, because you're not seeing the whole story. You're seeing, just like with that picture, you're seeing the tip of the iceberg, and none of us know what's kind of behind that. And the other part, you know, just to kind of speak to what you were saying before too, I always try to remind people healing happens at all different rates. It's not the same for everyone. And you're right. We've all seen pictures of someone like, oh, I just had surgery, right? And I'm out doing this. First of all, sometimes I go, you're not supposed to be out doing that. that's not a good idea to be doing that. But the other piece is, okay, and that's great. And if that's what they're doing, that's wonderful. That doesn't mean that that's what you should be doing or that that's right for you. Healing happens, whatever we're talking about, whether we're talking about emotional healing and growth, whether they're talking about physical healing and growth, it happens at different paces for everyone.
It definitely does. A lot of my patients have been talking about they feel like they're grieving their other life.
Yes.
Can you speak to that a little bit?
Oh, absolutely. And I think this is the hard part. You know, I had a conversation with someone the other day, a friend of mine who's also a professional, and she said, you know, we've been doing this for how long? And I said, you know, my husband and I were just talking the other day, March 12th was our last normal day. That was our last normal day here in Colorado. Everything shut down after that, you know, and we didn't have any warning. We didn't know, right? You heard stuff about COVID. We weren't really getting a whole lot of information. We were told, oh, it's just a flu. Most people will be fine. And the next thing you know, like, schools are closed down and the whole state comes to a halt and everything.
I put 400 people in a room just outside of New York City on March 1st. I flew speakers in, people, nobody said to me, and we asked,
No.
My business partner is Italian, so he was on top of it because his family was in Italy.
Mm-hmm.
We asked, is there a risk to this? Can we do this? We kept asking the hotel, could you, we don't know. We don't know what the impact, we didn't know, and that what was going on. There wasn't a lot of information going on out there.
Right, absolutely. And so then things just came to a halt. And I think, you know, I guess the biggest thing I can say to people, it is absolutely okay to be grieving those losses, right? The stuff that we normally would do, maybe going out to dinner with friends or going for a hike. I'm in Colorado, so going for a hike in the mountains, right? Or it's so hard. It's like our whole routine has been disrupted. Our whole family's routine has been disrupted, right? When going to the grocery store, like you said, feels like, right, going to Starbucks, I have my mask on and do I touch the door? And, you know, I actually had a newspaper bag on my hand the other day.
Oh my God, I love that.
I had no gloves and I was like, I'm not touching that door, right? But it brings up all these things and it's so much. And I think absolutely, we're all grieving, you know, like I said, this new abnormal world, grieving the loss of our lives, even working from home. I know there are a lot of people who are working from home and they're talking to me about how difficult it is working from home, especially if they have kids and they're trying to just homeschool them, do distance learning with them, or they have a partner who's home and it's so difficult, you know, and they're like, I don't get it, I'm working from home. And I keep reminding them, not really, right? You're at home trying to work during a pandemic. That is a difference to me.
So I do telehealth. I'm pelvic health, but I'm in my parents' condo because that's the way life ended up during the pandemic. And my mother would like to know a little less about vaginas and painful stuff because this is what life is. You know, there's no other way. So the best part is, like my friends are OTs. And if they're homeschooling their children, they're like, their kids want to play the OT games. They don't want to do their work from school. And we're all in this like crazy situation where it takes you 6 hours to go to Costco. Cause you have to, I mean, wiping down Costco.
Yeah. You got your mask and you're coming home and you're wiping down all your stuff and you're putting it away. And I think that's the other thing too. I think people are so tired. Right? I keep hearing that a lot from people. They're like, I don't understand it. I'm not doing my commute and I'm not doing this and I'm not doing that and I'm not going out, but I feel so tired. I feel so drained. And I'm like, yeah, because you might not be doing that physical activity, but your mind is doing mental gymnastics right now, right? We're all in this stress, anxiety place. And so that means our mind is just on overload. We're calculating everything. And like you said, right? Even a trip to Costco, you come home and you're just like, I'm done for the day. That was it. That's all I can handle. It is so difficult.
And yet the pressure that you have to be designing an online course that has to be released that day is still there.
And cooking healthy dinners every night and doing, you know, everything perfectly and wonderful. And I'll say the flip side of that, you know, we've been talking about working from home and partners and kids, but I think the other part to that too is people who are living alone. This has a whole different meaning for them, feeling like they are so isolated, so cut off from human connection and not having that. And again, I think for some people who struggle with fertility issues, hearing all these families together doing all these things really is bringing up so many issues for them. And that's so hard. And, you know, I think I've been talking to people about trying to connect like this, like on Zoom, on FaceTime calls, all that sort of stuff. If they have the energy to do that, reaching out to people maybe they haven't talked to in a while, we're such supports to them and doing that stuff. I get, though, that's the best we can do for now. I also get that's not the same. It's not the same. It's not the same as seeing someone, and it's hard, and it's taking a toll on people for sure.
I met at the Endometriosis Summit, somebody came early to volunteer, and then they went back to where they're from, which I don't even know. And they were the nicest person. They did so much for me all weekend. And then on Facebook, they're socially isolating alone. They're distancing alone. And it is, the stories of just craving being with someone versus, I know Netflix has the app, you can like watch a movie with someone, right? And she says she does that, but it's not the same. Like she can't see her nieces and nephews. She can't see, her parents have a dog. She can't go, it's very, right. It's super
very
hard.
different. You can't hug someone, right? You're not having that physical connection and contact with people. Absolutely, it's very hard. I had some people joke, when even the introverts are going nuts, there's right. I think that's very true.
And I think I like to say sometimes I feel like the people with endometriosis feel it a little bit less, but not feel it a little bit less, but that pressure that we have to go out all the time is now a little bit removed because there is no go out. So like I said, my birthday's Monday. Do you know how many birthdays I haven't gone out because I have pelvic pain or I'm exhausted or what from having a chronic disease, that now I'm like, whatever happens that day, it's going to be the best day ever because here we're in this space and time. But I also think it's very hard, the pressures of now I'm really alone for the people that are socially distancing by themselves,
right.
And it's scary. Yeah. Do you have any tip aside from the Zoom? I had a patient call, I said, you got to find people to Zoom with. I like the Peloton, not that I'm advertising them, but the Peloton app is free. So it feels like somebody's in your living room while you're jumping around and things like that.
Yeah.
Yeah.
And I think besides the Zoom and trying to be connected with people, I think again, what I've been encouraging people to do is if they can go out safely to do that, again, even if it's sitting on their balcony or patio, just to get out of the house, to try to make those connections. I know some people are having one friend who they say, I'm saying this with a little bit of hesitancy, right? Because I don't work for the Center for Disease Control. I'm not an epidemiologist. I cannot tell you for sure, like this is 100% safe, but I know some people have also, other single friends that they've kind of formed their own little community of, okay, if we just see each other in this pandemic, just so we can have some interaction, or let's sit in the driveway 10 feet apart with masks on, and just so we can actually have some interaction. Again, I think I'm certainly not advocating that people do that if they don't feel safe to do that. I can't tell you,
right.
You have to follow what's acceptable.
That's a pod. That's the new term. That's your pod. I learned that yesterday.
Right.
I had a friend and I stand in the driveway and she stands on the second floor balcony. That's pretty far apart.
Yeah.
She was invited to a party where it was in a parking lot and everybody stayed in their own car.
Yeah.
And in fact here they had an outdoor concert like that to thank all the first responders, which I loved because I could hear it and dance on my balcony.
Right.
Right.
And but I think if you feel safe doing something like that, absolutely, right? If you're both wearing masks, you're practicing the distancing, just so you can have some of that connection.
Yeah, I think it's going to be evolving how we live now. In terms of endometriosis, almost all of our surgeons are back to work. Some of them have gone to surgical centers, and a patient told me that she can have her surgery. So yay, because it was tremendously anxiety inducing what's going to happen to her care.
Yeah.
But she is not allowed to bring another person. Those are that surgical center's rule. So she has to be dropped at the door. So we had to troubleshoot. She can't even think about, you have to take a bowel prep to do endometriosis surgery. Right. She couldn't even think about going and buying the bowel prep stuff because she was so upset that here on her first surgery, we're going to drop her at the door and The doctor, who may or may not remember to call her parents, he's going to call them when they can pick her up.
Wow.
Yeah.
You're right. It's such an isolating experience, and not having that support, not having those people with you, right? To hold your hand, to reassure you, to be there. Yeah, so difficult.
So we try, if lots of my endometriosis community is out there in the same situation, we troubleshot as much as we could, but we also reminded everybody that nurses are amazing.
Yeah.
Support staff that's going to be in that surgical center is aware that this is a horrible thing to have to happen, and they're going to be super supportive. And it's perfectly okay to lean on a stranger.
Oh, absolutely. And I think that's such a great thing that you said. Right. Because nurses, that's what they do. They're caregivers. They're there for you. And especially if you're having surgery at a place like the Center for Endometriosis Care, right? I'll just put my little plug in there. Heather and the Center for Endometriosis
They're
Care.
the best.
Right. But right. Who have staff members who are caring, who get it. They get what you're going through. They don't want this to be their new normal either. And so you figure it out, and you figure out what you do. And you're absolutely right. It's okay to lean on those people to take care of you. That's what they're there for.
The other thing I found really interesting, and it's a trend, I'm not an epidemiologist and I'm not a researcher, but my patients that have had surgery have had all sorts of histamine responses. They've had all sorts of allergic reactions. They've had exaggerated pain responses. And so one of the things that we were talking to with 2 or 3 different doctors were, you're going into surgery with stress levels so high that it affects what your body is, how your body is able to manage this. Because surgery itself, of course, it's stressful to the central nervous system. Do you have any tips if people are in that situation of how they can sort of like manage their pre-surgical stress a little better?
You know, I think you're absolutely right. First of all, just to kind of piggyback on what you said, you're absolutely right. I think when we're in this heightened stress response, right, and we're kind of stuck in almost this flight, fright, or freeze response all the time, it absolutely has an impact on our bodies, how everything, right? People are talking about how they're not sleeping well. If they're having surgery, they're not healing well, and how that does impact your body. And so I think some of it is the general anxiety management stuff, and then making it specific to your situation, right? You know, when we're in that response, it's our sympathetic nervous system that's just kind of super on hypoarousal. One thing that I talk with people about a lot is deep breathing, which again, I know as it becomes kind of part of more mainstream culture, it almost gets a little convoluted in the sense of like, just take some breaths and you'll feel better. And that's not what I mean, right? That's a very dismissive way to look at it. But deep breathing is really one of the quickest ways for your physical body, for your parasympathetic nervous system to kind of kick into gear and help with some of that anxiety response. So I talk with people a lot about breathing deeply. You look like you want to say something.
Yeah, so no kidding. Like, we as physical therapists, we love the breathing. It's one of the ways you can, especially in telehealth, you can access the central nervous system, and you amp up the, resting response of the part, right? So I have this patient, she was like covered in an allergic reaction, and she's like, her not healing well from surgery. And I'm like, okay, now you're going to put your hand on your belly, and then you're going to put and she actually in the middle of the session told me to F off. And I was like, I had to think about it for a second, and I was like, you know what? I deserve that, because you're like coated in Benadryl and you're still not getting. And so I said, what's calming to you? What's nourishing to you? And she had to think of her own strategies. But I was like, first we're going to put our hand here, and then we're going to put her, and she was like, and then I'm going to tell you where to put your hand, because, right. So, yeah. And I think it goes to like when you were saying in the beginning, there is that person that eating cheesecake and taking bubble baths, that's what works for them. And if you tell that person to breathe, right, they're going to be like, screw you, I'm going to get apple pie. Like they're, and so while I don't encourage I encourage it in my own home, but with patients, I don't encourage the eating, right? But, I do. It taught me a lesson really quick, and like we have to. If you hate breathing, if you hate organized breathing, I don't think your parasympathetic nervous system is going to calm down at all.
Right. And I honestly, I think you're absolutely right. And I talk with people about that all the time. They get a little sick of me saying, breathe, breathe, breathe. I talk to them about research and stuff, but you're right. Sometimes it's said in such a and I certainly don't think you were saying it dismissively to your client, but when someone's so panicked that they're hyperventilating and you're like, just breathe. They're like, yeah, screw you. That's not helpful to me right now. Right. But having said that,
Right.
I do think it's a helpful response. One thing, I was partly laughing about what you said, because one thing that my clients know very well about me is I give them very vague instructions for everything. And I do that purposefully because people who are prone to anxiety, when you give them like, do it this way, right? I want you to breathe and I want you to hold it for a count of 3. And I want you to go in through your nose and out through your mouth. And I want you to, they get like, what did she say? How am I supposed to do it? What is this doing? And you're absolutely right. That's not helping anything. That's like amping things up. So I think, you know, I'll still put in a plug for deep breathing, especially if you're feeling really amped up. But right, finding the way that works for you and what that looks like for you. I think in general, some other anxiety management stuff is just journaling. I love journaling too. Again, some people think it's like the biggest bunch of hooey. I'm old school with journaling, like take out your pen and paper and write stuff down. It can be, but sometimes it's just bullet, right? Like I feel anxious about my surgery and that's okay to feel anxious about my surgery. And what does that mean for me, right? That's the other part is accepting that feeling. It's okay to feel super anxious about that, or it's okay to be grieving that piece, or it's okay, whatever is going on for you to, you know, it's okay. I'm feeling anxious in the moment and really kind of being kind to yourself of course you're feeling anxious in the moment. We're in the middle of an unprecedented situation. You know, and so then what do I do for myself? How do I practice that self-care piece? And for some people that's deep breathing, for some people that's eating their cheesecake, for some people that is going for a run, for some people that's lying in bed and allowing themselves to take their pain medication. Right? You know, the general anxiety management stuff though, the breathing, I think meditation is super helpful too. Again, I don't mean necessarily like home. And if that works for you, that's awesome. But sometimes just that moment of being aware in that moment of where you are, taking your breaths, recognizing your thoughts. You know, I'll speak a little bit to mindfulness in the sense of mindfulness is one of those other great tools that we've kind of been talking about in the mental health field for years. And it's kind of gotten a little misunderstood, lost in translation a little bit in terms of how it's become part of the mainstream. I'm happy it's part of the mainstream, but one big thing that mindfulness really talks about is kind of being present where you are, allowing yourself to feel your feelings without judgment, right? And that's the piece that kind of gets cut off, right? So of course you're anxious, and that's okay to be anxious. And not try to fight. And that's the thing with anxiety too. The more you fight anxiety, I don't know, I'm sure you've seen this in your patients too, or maybe in your own life. The more you fight anxiety, the more anxiety goes, hey, pay attention to me. So then you start become anxious about being anxious and why I'm anxious and stop being anxious and don't be anxious. It's sort of like if I said to you, hey, Dr. Sally, think of a banana. And then I go, are you still thinking of a banana? Why are you thinking of a banana? Stop thinking of that banana. Are you thinking of a banana? Right? We kind of do this thing where we're like, stop being anxious. Well, that doesn't help us,
Right.
right? It's like,
Right.
just recognize that you're feeling anxious about your surgery. That's okay. Try to use some of your strategies that are calming for you. Some of that could be deep breathing. Some of that could be journaling. Some of that could be meditation. There's some great apps out there. You know, I'm not affiliated with them in any way, but Calm is a good app. Headspace is a good app.
You're not affiliated with Calm, but Calm was the Endometriosis Summit sponsor for 2019.
There you go.
So some of that is still around. If you still have your gift bags from 2019, there are Calm coupons in there that are still good, no less. While you're talking about anxiety, we had a question, and we're going to take more questions, but we had a question that said, what if, you know, you come to the table with a generalized anxiety disorder, and like the whole world does,
right.
But you come to the table with that generalized anxiety disorder, and then now with COVID, it's a perpetuation of the anxiety about worrying about your family, about worrying about, is everybody safe? Is this person safe? Is that person safe? What's some good ways to manage? I think you've given a lot of good ways in that you can't control everyone. You can only control, but what are some other tips and tricks you have for that?
You know, I think that's a great question too. I'm going to kind of give a two-part answer. I think in the immediate piece, if you feel yourself feeling really in an kind of in an anxious or panicked place about it, really worried, I think that's a great time to really kind of use your breathing and kind of use your thoughts, right? Of, I cannot control what everyone does. We're doing the best we can. We're practicing our safety things. I have to trust that we'll be okay. I can only control the pieces I can, right? So if it's a more acute thing right in that moment, you're feeling super amped up and anxious or maybe panicked about, oh my gosh, are they okay? Are they this? Or they, did I touch my face? Did they touch their face? Did, you know, it's like, okay, let's try to kick that parasympathetic nervous system into gear. Let's use your breath. And while you're doing that, kind of remind yourself, it's okay. We're doing the best I can. All I can do is control the pieces I can control. I think in the bigger sense of that, so that's kind of an immediate, if you're having that immediate anxiety response. In the bigger sense of that, I think it is a tough issue. You know, as you talked about, I also have family members in New York, some of who are on the front line of things. It's hard not to worry about what that looks like and what they're being exposed to, and will our kids be okay, or, you know, what about my grandma, or what will this look like, or what about my niece and nephew, or it is hard. And I think it is part of that piece. Again, you can't control what other people do. I have to be honest with you, I've been having a lot of talks these past few weeks, especially as this has gone on, and fatigue of following all these regulations has set in for people. Family members are fighting over what's safe and what's not safe. You know, is it safe to do this? Is it not safe to do that? Can I go over to my parents' house? No, it's not, you know. And so I've seen a lot of that. And I think some of that is reminding yourself that, you know, trying to do the best you can in terms of staying as safe as you can, whatever that looks like for you. And like I said before, people's risk tolerance is different. And then reminding yourself, there's only so much of this that I can control. You know, certainly I can send sort of love and light to my family members, or healing thoughts, or safe thoughts, if that's what I want to do. But that piece of, I get that people have an underlying of worry. I wish I had, like, again, this great, wonderful answer I could say of like, do this, and that will stop you from worrying. The truth is, I think we're all worrying a little bit, and that's what makes it so hard.
I find, you know, because I have New York roots, actually I have brown roots, not blonde roots right now, but whatever, that's a different conversation. I'm going to, you know, but I have friends that are, you know, they're an essential worker and they're worried about their family all day, or their husbands are, or their partners are essential workers. I know, one of them, like the partner's anesthesiologist, and it's the worry, like, other people don't get it. I'm not sitting home watching Netflix. I'm sitting home hoping my husband doesn't come home either dead or kill us.
Right.
You know, and I think taking it in and realizing that everybody's going to have a different level, and, you know, maybe society being a little kinder, and realizing that for a lot of people, it's not stay at home.
Right. Which, you know, and I think this is so hard. I have to be honest, I struggle with not kind of shaming people in terms of how they're handling it. And I was almost just going to respond to you, you know, when you said it's not, you know, people cannot stay at home. I was going to say, and that's all the more reason for the people who can stay at home to stay at home. But, you know,
that's
again,
what I feel, but that's okay.
Right. But people have to handle things the way that they feel is the best way to handle them. But I think you're absolutely right. You know, as we're talking about this, people who are essential workers themselves, or healthcare workers, and they're terrified of bringing something home to their family. I know some people who are living in trailers on their property because they don't want to bring things into their home. They're so worried about what that looks like. And, you know, again, I wish I had like a wonderful magical thing I could say, like, it's okay. I hope and pray that it will be okay for everyone. I think some of that, though, is allowing yourself to feel that, right? Not in a way where you sit in that and let it overtake you so you cannot function, but more the sense of saying, yeah, I'm freaked out and I'm worried. Understandably so. And it's okay to be freaked out and worried.
So I think that need to, like I was outside, well apart, and like somebody was like carrying packages from Bed Bath and Beyond, and I wanted to scream, because there is nothing essential from Bed Bath and Beyond. You put it in home at Amazon. You don't have, and maybe she just had the bags. I don't want to be completely judgmental, but it to me, I just want to walk around scream. Like, the opening up has brought me a new sense of panic. And I see all the likes on the Facebook going on right now, and opening up, and especially that we're not opening up, like everybody's not doing the same thing. And in Florida, I'm thankful that South Florida is moving slower than North Florida, but North Florida, they're like, restaurants are fully packed and the hair salons and what, and like, I don't, and I'm like, I think opening is also a sense of stress to people. Because I feel like they should stay home so that my friends that are essential workers aren't dying, but that's okay.
But I know, and it's, again, I really try not to judge people and making their own choices. It is hard sometimes when you, when you're in a situation where right, it's impacting people. And I'll tell you, I was talking to someone who is a hairdresser. That's what she does, and she has her own business. And she said, I know they said in Colorado they can open now. The deal is they're supposed to wear a mask. Their clients are supposed to wear a mask. She said, but I'm terrified to open. And I feel like I should, because they're telling me you should be open. And clients are contacting me saying, you can be open now. When's my appointment? She's like, I'm terrified. What does that really look like? And the procedures that are in place between what I have to do between each client who comes in after I do a service on their hair, I mean, they're terrified of what that looks like. So it's such a hard decision. And what I told her is, if you don't feel comfortable, then don't open yet. And I realize that's easy for me to say. She's missing out on income. That's hard for her. And I will own this, as I say this, I realize that I'm saying this from a place of privilege as well. I am seeing clients through telehealth. So I am still making money. I can pay my mortgage. I don't have to worry about if my family is going to eat. And I think that plays into it too. I understand that there are some people who have lost their livelihoods. And so they're like, I have to work. You don't understand what that's like. And you're right, I don't understand it in the same way that do it. So I really try to not judge people in their choices, but you're right, sometimes it is kind of hard of like, you see someone at the grocery store and they're not wearing a mask and you're like, wear a mask.
I know. I had that, I'm technically essential because I'm, although I do feel that what I do can be done on telehealth, and there are a handful of cases where you have to be seen.
Yes, and I'm in the same position. I am also essential, but I can see people through telehealth.
I didn't feel that I could keep the clinic clean and make sure 100% that I'm not spreading, that you're not getting it on the way to me, because my father is like, what is going to be the liability of everybody? And so it's not just that, but if somebody coughs on me because they feel that they're low risk or something happens, even through a mask, and I bring it home to my parents, I have to live with that the rest of my life. That has to be my decision. And I've had patients scream at me. I had somebody scream at me in the middle of March that I had failed her because I wasn't open and she needed care. And you know what? Here's a list of 10 names, because I couldn't handle it emotionally. And if I can't handle it emotionally, then I can't be present. But I take it this way. That's a luxury. You think the person working wherever, not everybody has that luxury.
Right.
Or that privilege. And I do feel like it's such a source of anxiety. Nobody knows how to feel. And there are tons of people who cannot stay home from work, and they're not sitting on Facebook at 4:00 on a Friday afternoon. They're out working, and, outreach to manage their anxiety level and be with them matters too,
Right. Yeah. Right. And I think that is, I do try to understand and recognize everyone needs to make their own choices, and how this whole thing is impacting them, right? Their health, their livelihood, their emotional health and well-being. Again, I want to always remind people to be as safe as you possibly can. And kind of even going back to what you were saying before, I'm sort of skipping around a little bit, but going back to what you were saying about people who have essential workers in their family, I mean, that is such a difficult thing. And we've talked about, okay, again, what are the pieces you can control, right? And I know some people, they get home and they strip down in their garage and they run in the shower, right? And they throw stuff in a pail that then they dump in the washing machine and start it going, and wash their hands really well and get in the shower. And I think those are the pieces, right? I know in this time where everything feels so out of control and uncertain, I think it is kind of going down to, what are these little parts that you can control so that you feel as safe as you can in this situation? But it is anxiety producing.
Yeah. And I think, what are the parts that you can control is like a mantra for those with endometriosis, because lots of people, unfortunately, because of the state of care, the standard of care in the United States, a lot of people have trouble accessing best quality treatments
Right.
like excision. And so, we have a question in the Q&A here on Zoom that, how do you manage stress while, because insurance is not
Mhm.
allowing you to get better, and you have to control what you can control and chart your plan, which is what you just said, basically.
Yeah. And I'll just throw in this other piece with the insurance, because I am a provider who takes insurance, which I realize, sometimes in the mental health field, it's hard to find providers who take insurance. For me, I could go on a huge tangent about, for me, it's kind of a cool piece. It was how I grew up, right? If someone didn't take our insurance, we didn't go see them. And so I made a commitment that I would take insurance, even though they're frustrating to deal with in my practice sometimes, which is my point of that. I think being your own self advocate is one of the best things that you can do. And I know even that gets exhausting sometimes too, right? Especially when you're dealing with a chronic pain condition. It gets so exhausting. But I think there's so much to that empowerment piece and being your own self advocate. And I say that goes to the insurance companies too, right? Contact them, let them know what you need, have your providers contact them. Sometimes I think insurance just gets sick of hearing from me. And so eventually they kind of go, all right, lady, we'll approve this because we're done. But my point being is, I know it's exhausting when you're dealing with a pain condition, but I also really want to encourage people to empower themselves as best as you can. And insurance companies should not dictate your health to you. I know that we live in a world where they often do, but I'd say fight that. Talk to them. Have your provider talk to them. Talk to the HR company of the HR department of the company that's providing that insurance, or if you're getting it from the exchange, or use what you can and vote for people who have a similar vision for you in terms of healthcare and insurance, so that people aren't kind of pushed to the wayside. And I think especially when you're talking about endometriosis, which is primarily a condition seen in women, right? It gets the short shift. It gets pushed to the bottom of the pile. It gets ignored. And right, people have to fight for that treatment and that care that they need.
Yeah. Very good advice. I am going to, for those of you just joining us, we are here with Dr. Jennifer Ritchie Goodline. And if it cuts out, we will have a problem. But if it doesn't cut out, I'm going to take just 2 to 3 questions from Facebook, if you are willing to stay and
Absolutely.
answer them. Okay. So, most of the questions really are on, other people are not following the rules. Which I'm big with that. Like if I would have hit that woman that walked into Starbucks, only allowed in Starbucks, like a little teeny, you're allowed to go in, take your cup and leave, but she should have had a mask on.
And I agree with you. She should have a mask on. I can argue sort of the research that I'm reading every day, again, as an essential worker, making decisions about when I open my office and what that looks like. I am reading the research. Part of the reason I don't open my office is because I would have to wear a mask and my client would have to wear a mask, and I cannot imagine doing therapy in masks. So I will say this is an issue. I'm going to totally own that this is an issue I struggle with as well. Like, follow the rules, right? Just if all of us just did what we were supposed to do, hopefully we could get back to like some sort of normalcy sooner rather than later. So I hear all that stuff that brings up for people. Having said that, again, I know I sound like a broken record, but this is my mantra, especially in these stressful times, is control. You cannot control how other people do this. You can't control if they wear a mask. You can't control if they're socially distancing. What you can do, though, is control what you feel is safe for you feel is safe for your family, you feel is okay for you. And if that means that maybe you don't go to a place because you know that people don't wear masks, that's okay too, to give yourself permission. Or as I said, like the person I talked to who wasn't feeling quite ready to open her salon yet, that's okay. Give yourself permission to take care of yourself.
Right. So somebody that I was talking to over Zoom, they said because so many people don't follow the rules strictly enough at work, they're wearing a mask and a face shield. And so that's sort of an example of that's what she can control. She can't control that Susie that sits at the desk partitioned next to her is not doing what she's supposed to do. She can only control her part.
Right,
And
and where her face can
right,
mail. I could also throw out, I don't know what state she's in and what her company has for guidelines, but that might be worth talking
yeah.
to whoever she needs to talk to of what is supposed to
Unfortunately,
be happening here.
right. So I think a lot of our stress and anxiety is because states are executing it all individually,
Yeah.
but unfortunately, a state that wouldn't listen, but a state that does listen, I do say I connect to when Governor Cuomo and when Governor Murphy say, I wear a mask for you.
Right.
Right. So and I connect to that because I, like, when I'm running, I have the mask pulled down, but if anyone comes like anywhere, I pull it like right up, And so, and it's hard. It's very hot here. And I think I'm wearing it for them. They have the right to be outside, but my whole life has been, I'll do this for you. I would like people to do it for me. Yeah, which is why I wanted to have you on today, because I think just recognizing that most of the country feels, or most people feel, hey, I need you to do this for me now. And that frustration is going on and on. Great. So I want you to tell everybody how they can reach you.
So the best way to reach me is actually going to my website, which was just redesigned by my fabulous website designer, who I believe is on here today. So shout out to her. But it's I have my big long name, so I'm going to say it for you, and then I'll throw a little spelling in there. It's www.drjenniferritchiegoodline.com, all one word. So it's basically Dr. Jennifer with 2 N's. Ritchie has a T in it, Ritchie, and then Goodline, just as it sounds, .com. And that has my email address on it and a phone number on it, if people do need to reach me for anything.
I do have to say, I design the Endometriosis Summit stuff, and so I had to go through your website, and it was a great website. I didn't realize it was new. Looks great.
Well, it was just redesigned.
Oh, I loved it. Yes. All right. Do you have social media people can follow you on?
I do. I'm still old. I'm old, so I don't have a Twitter. I have an Instagram. I know my kids were teasing me about, like, Mom, you need to get a Twitter. You have Instagram and Facebook, but I have an Instagram and I have a Facebook.
Honey, now you need to get a TikTok.
Oh yeah, and Snapchat. I don't have any of them, but I do have.
Done. We're TikToking.
Oh, Snapchat's done. See, I didn't know that. You're cooler than me. So my Instagram is at Dr_JRD, JRG_PSYD, PSYD. And my Facebook, you can just find, it's Dr. Jennifer Ritchie Goodline on Facebook. Yeah.
So I hope you'll come back and join us another time.
Absolutely.
Yeah. And we want to say to everybody, we are going to have Movement Sunday. It will be a breakout dance party at 9 a.m. on our Instagram Live. We'll have a graphic up within the next 24 hours. We will be joined for that by Neva Hertzig, who is our physical therapist that dances us at the Endometriosis Summit. So we thought, enough with this stressful conversation. It's time to boogie down a little bit.
I love that. I think that is so awesome.
So we will see you on our Instagram Live on Sunday morning at 9 a.m. And thank you so much for coming, everybody.
Yes, thank you. And thanks for having me.
Oh.